The Healthcare Labyrinth Podcast is back for another episode. Join Marc S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth Podcast. My name is Marc Ryan, and it's a pleasure to be hosting the podcast, and thanks to everyone for listening in. Today, we're going to talk a little bit about a personal journey I've been on. And it involves me taking what's known as a GLP-1. This is one of those rather new brand weight loss drugs that are extremely, extremely expensive. Now, one of the reasons I went on the drug is because I have diabetes and I am slightly overweight. Over the last 17 years, I've had a diagnosis of type 2 diabetes. I tell everyone it runs in the family, which is indeed true, but I admit privately, and I guess I'm admitting publicly now, that a great deal of my diabetes is probably tied to my poor eating habits and lack of exercise, as is really the case with probably many diabetics out there. I have tried a great deal over the years to keep my hemoglobin A1C below 7. That includes some dieting and some exercise, and also a drug regimen. And it worked for a while. I was initially on a set of legacy generic meds that were very low cost, and my hemoglobin A1C was below 7. And that's the important benchmark to be under. Your blood sugar long-term level should be below 7 if you're a diabetic, so that you're not causing any problems in your body, especially to your kidneys. But after a while, those generic drugs alone were not working to control my hemoglobin A1C levels. And I went on a fairly expensive brand drug as well. And again, that worked for a while. I was still below 7. But as I closed in on my 60s, I began inching up and finally went over a hemoglobin A1C test of 7. And at that point, I sat with my doctor talking about what perhaps was next. I could have gone on another, probably brand drug that was not an injectable like a GLP-1, but we were a little dubious about whether that would probably have a lot of great impact for me. And we ultimately talked about, again, this GLP-1. I have gone on it with great reluctance for a couple of reasons, because largely I am a new drug skeptic. And what do I mean by that? Well, just in my studies of the Food and Drug Administration and brand drug companies out there, I really don't believe the FDA or brand drug companies have the best interests of Americans at heart. I think the FDA is entirely inept in terms of what they do to safeguard Americans from introduction of bad drugs. I think the drug makers are remarkably greedy, and therefore they aren't really devoted to safety either. And I would note that there's just a incredible revolving door between drug makers and regulators that I think creates a huge conflict of interest that clearly compromises safety. So again, as a new drug skeptic, I am very reluctant about going on brand new brand drugs unless they've been on the market for a while and I can figure out exactly whether they are safe and actually effective. And actually more effective for that matter than other drugs that are in the market, whether other brands or other generics. But in this case, in consultation with my doctor, I did decide to take what I call the GLP-1 plunge. So that is sort of where I am. I will tell you the results so far after a couple months have been rather dramatic. While I have not gone back to the doctor yet for a new hemoglobin A1C test, that will come up sometime in October, and I'll let you know the outcome. But I have lost more than 20 pounds, and the pounds keep coming off. And from everything I can tell, I'm on the right path. I feel a lot better. I'm more energetic, and I believe that eating less will make my hemoglobin A1C probably go down rather dramatically. So with that, we're going to take our first break before we get into a little more about my journey and really my exhaustive hunt for my GLP-1, because it is one of those drugs on a drug shortage, and it's also incredibly expensive, and we'll tell you why many people are unable to get their drugs today.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Marc Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Marc dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage in a private delivery model. Marc is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Marc's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth Podcast. We're talking today about my new journey on GLP-1 weight loss drug and my exhaustive hunt to actually fill those prescriptions for the GLP-1s. So immediately, I had a major battle with consistent supply of my drug. And my biggest issue clearly was availability. And given my general abstinence, I set out to really discover what this was all about. Why was the drug in short supply? Why could most druggists or pharmacies not get the drug for me? So to be fair to all, I am leaving out the pharmacy names here and the drug names themselves. I don't want to level necessarily against given drug makers or pharmacies out there. But I am going to disclose one of the pharmacies that were on my journey, to which I am now very devoted because they really helped me out here and helped me find consistent supply of the GLP-1 drugs. So that's the only entity I'm going to really talk about. But what I did find in my look at availability and why certain things were happening with this drug shortage drug, I found a familiar pattern in how drug pricing, supply, and availability generally works. And I think it not only impacts GLP-1 drugs, but many other expensive brand drugs as well. And I've sort of concluded here that a drug can be in short supply, and that could mean a hard time getting it at a pharmacy. But there are the high cost of the drug and the way the drug system works also can genuinely contribute to the inability for people to get their drugs, even if their drug is in short supply. As many of you may know, you must begin slowly on a GLP-1 weight loss drug. And basically, your body has to adapt to it over time, and therefore you increase your dosage over a series of months if you're a diabetic like me. In my case, again, I had multiple months of increasing dosages. I have used one big pharmacy chain for most of my life. I was very devoted to them, and I thought they did a good job for me. But my initial dose of this drug, this GLP-1, was late by about 2 to 3 weeks. And I only received that drug due to my, what I would call my badgering of the pharmacy. I have to say that pharmacy chain, which I thought usually did a really good job for me, were very unhelpful throughout and refused to really give me firm updates or information along the way. I thought this was initially just about the shortage of the drug, but I determined it really was not. So let's go on my journey here. As I told you, my first dosage was late by about 2 to 3 weeks, but with my first dose finally filled with my pharmacy that I had gone to for most of my life, I quickly set out to ensure my next higher dose would be available early so there was no interruption of my treatment. Because that next dose was higher and you had to make sure you got that next dose right after your last dose so that you could continue progressing up the chain until you received that highest dose that you need. So anyway, I set out again to make sure it was available earlier so there was no interruption. I dutifully called my pharmacy benefits manager to ensure that every dose I needed over that several-month journey was pre-approved and the appropriate edits were in the claim system. So that would be one big problem I would face, I felt, if the drug was in shortage. So again, I got on the phone with my PBM. That took me a good 2 weeks of fighting to get the pre-approvals and the claim edits put in the system, but I finally got that done. During this time, I continued to work with the pharmacy and again received the same lack of transparency and poor treatment. So notwithstanding the fact that my PBM came through and put all the edits in the system, when it was about a week out from my next dosage, I still did not have a commitment from the pharmacy that I was going to get my drug. And as those next couple of days rolled out, I did not have my drug. And it was very upsetting to me. Pharmacists, again, were not very helpful. They dodged my questions. They would not answer my questions. And there's just a fundamental lack of transparency, as I indicated. So at this point, I began calling other large drug chains. I called freestanding drugstores, those associated with larger retail establishments, and those associated with grocery stores, really everyone out there, as well as independent pharmacies around my home in Florida, as well as in Georgia, a fairly rural area, Georgia, where my family goes each summer for several months to escape the heat of the summer in Florida. I heard the same things when I was talking to these various chain drugstores and the independents. So let me sort of walk you through that. Well, number one, I asked my long-time pharmacy again whether they stock GLP-1s. And this very large retail chain said, no, they do not. I asked the same pharmacy to order or call around to other stores a week to 10 days before my refill was needed to ensure no interruption. They were unwilling to do so. I was sort of extremely surprised by that. That same pharmacy stated that they order within a few days of my refill date. And if it is not in or available in the coming week from that point, I'm basically out of luck. They're really not going to do much more for me. Well, that's pretty great customer service from one of the leading pharmacy chains in the nation, huh? It was just mind-boggling to me. But other chains actually followed the same policy. They were not willing to help people who wanted to get their GLP-1s at all, really. They were not willing to work with me to gain my business even. Independents were far more transparent in my conversations with them. And this actually sort of also was true about what I would call the grocery store chain pharmacies. Both the independents and the grocery store chain pharmacies explained that they had no leverage given shortages in the market, which I sort of suspected. But more important, they told me that they lose money on every GLP-1 filled and frankly simply couldn't afford to do it. And they actually apologized profusely to me. They were very, very nice people. And I asked myself a few questions. How could this be? Losing money on every GLP-1 drug they fill? And could this actually be the case, too, for some of the retail chains out there? So with that, we'll take our second break before we go on and tell you about how I did find some success from one large drugstore chain. Be right back.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back, and we hope you're enjoying this edition of the Healthcare Labyrinth Podcast. We're talking about my journey obtaining a GLP-1, and so far we've told you about how most chain drugstores and even the independents weren't ready to help me and really help me really get my drug, despite the fact that it was in short supply. But I did stumble on one large retail drug chain that would work with me and quietly explain to me why I was getting the treatment I was getting from other drugstores. They too actually may lose on every GLP-1 drug they fill, but they have a corporate policy to try to quote unquote stock the drugs their patients need to ensure consistent therapy. This is in part due to their customer service philosophy, but it also has some, economic reasons for them to doing so. I was willing to transfer all my drugs to this retail chain, and presumably they make money on my other drugs, even if they wouldn't make money on my GLP-1. And more importantly, I walk the aisles of their larger retail store and make other purchases. So there is some guiding customer service philosophy to what they're doing here, but also some sound economic and business principles as well. So let me tell you a bit about what this very large retail drug chain with locations in Florida and Georgia did for me on my GLP-1 hunt that every other drugstore was not willing to do. So first, they reminded me to get my doctor to call in the next dosage early so they could actually begin looking at the issue. The drugstores in Florida and Georgia had to coordinate my scripts at different points because I was living in two different locations, and they did that rather seamlessly. The pharmacies also have a policy of looking up availability on behalf of their patients and ordering the relevant GLP-1 drug if that dosage would be needed by a patient much earlier than the other retail drug chains. This could actually happen weeks before, because what they were doing is they were looking, in my case, for all the folks that needed to GLP-1s, what their next dosage was, and we're identifying if it was on back order in a given week or if it was available. And what could happen from week to week, it could go back on back order and not be available. So they were locking in and purchasing the drug on my behalf weeks beforehand. So when I was coming in for that next dosage level, it was indeed available. And yes, they even told me that sometimes this means too many of the expensive drugs and dosages if a patient does not stay on their therapy. And that's actually a big issue with GLP-1s that we know about. But this is an absolutely critical service that this retail chain does for those who need their drugs. And they told me it was not just about GLP-1s, but there were other brand drugs that were extremely expensive or other brand drugs that were on back order or in drug shortage. And they actually practiced the same things that they did on the GLP-1. In the end, this is not technically stocking the drug, I guess, but it is very close to it. And I was positively impressed with what this chain retail pharmacy did. And so here's the unveil here. Again, I told you every other major drug chain and even the independents, perhaps the independents through no fault of their own, but every other drug chain or independent was unwilling or unable to help me. But Walmart Pharmacy did help me. So thanks, Walmart. You are absolutely the best. So here's really the skinny on my exhaustive drug hunt, and really what's going on with supply issues here and the inability of many people not to get their drugs. So several major retail chains are unwilling to work with customers to find their GLP-1s. This was the case regardless of whether the retail chain was associated with a PBM or not. We'll talk a little more on that later. These chains were less than transparent, were unhelpful, and deliberately obfuscated the issues. And again, I'm aware that using deliberately with obfuscated is not needed. It's a bit redundant, but I'm still really upset about my treatment at these pharmacies. Independents and some grocery chains had some very nice and knowledgeable people and told me the way it is. Quote, "We don't have leverage and can't take the losses," unquote, is basically what they told me. I actually appreciated the sincerity. We are losing these independent pharmacies due to market forces and the consolidation occurring both in the pharmacy and PBM industries, and this is actually very sad. So how does the drug supply chain stack up on GLP-1s and perhaps many other brand drugs? Well, brand drug makers, they clearly make the most on these GLP-1s. They're obscenely priced, and the drug makers have little incentive to grant any major discounts to wholesalers. Let's talk about the wholesaler middlemen. They do not get large discounts from drug makers on GLP-1s, but it's really hard to feel sorry for these mammoth guys as they make money both on the supply side and on the buying side. So they're actually doing pretty well. Pharmacies, on GLP-1s, wholesalers are not granting favorable pricing. When PBMs are ready to reimburse pharmacies for dispensing drugs to a member of a health plan or an employer group, the PBM often is under reimbursing for that brand drug. Thus, pharmacies, big and small, potentially can lose money or barely break even on GLP-1s and other brands. Losses on GLP-1s can be in the tens of dollars or even more depending on a pharmacy's buying power. So to get back to my conundrum, again, my drug was in general short supply or back order. But compounding that problem was the fact that all independent pharmacies likely could not make money on it. So they just could not even economically afford to even dispense the drug. But even some of the large retail chains lost money on them, apparently. And despite their mammoth size, were unwilling to actually work to even get the GLP-1 for me because they were going to lose money on it and they didn't really care very much about me. It was only Walmart who came to my rescue and had a policy of stocking or very close to it and dispensing that drug regardless of whether they were going to make money on it. And that's the real problem here. The drugs shortage, as well as the fact that reimbursement on these very expensive GLP-1s and some other brand drugs is poor, and therefore pharmacies cannot reliably make money on it the way things work. Now, let's tell you a little more about that. I told you earlier that brand drugs charge obscenely high prices for drugs, and they have little incentive to grant any major discounts to wholesalers. Therefore, the wholesaler can't give preferential treatment to the pharmacies who are buying from them. But let's go now to the PBM. We told you already that they not only squish the reimbursement to pharmacies, but they actually are likely charging employer groups and health plans much greater prices for these drugs. So they're winning big time there. They're reimbursing pharmacies low, and they're charging employers and health plans much greater prices for these drugs. They also, though, enter deals with brand drug makers and gain a handsome rebate on GLP-1s in return for favorable treatment on a formulary. This rebate usually is not shared with pharmacies to reduce their costs. With the consumer at the point of sale, nope, they don't get it either. Or with employer groups on the back end, nope. Essentially, the PBM is pretty much keeping that rebate. So they're under reimbursing the pharmacy, and they're keeping that rebate. and they're pocketing that by and large. So with it not being shared, that's where we get the problem. The rebate goes to the PBM from the brand drug maker, and there's very few discounts offered the wholesalers, the pharmacies, and therefore the PBM under reimburses, and the pharmacy loses money dispensing the GLP-1 or some other very expensive brands as well. And I would point out the larger the cost of the drug, the higher the cost of the drug, the more obviously the pharmacy is going to end up losing. What I found interesting as well is a pharmacy that was actually associated with a PBM would not even help me on the stock issue. And that's largely because there is a distinct line drawn between the pharmacy operation and the PBM. They work very much independently. However, even though they weren't willing to help me, there very likely were favorable payments from the PBM to a sister company pharmacy to keep dollars within the family. And so that's another way that these PBMs aligned with pharmacies make money. They keep the rebate and they actually pass a greater amount of reimbursement to the pharmacy, yet that sister pharmacy was not willing to help me anyway. So with that explanation, we will take our last break and we'll come back to sort of just conclude and sum up some of the things we learned today.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Marc Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Marc's insights. Twice a week, Marc publishes a blog to go deep into a current issue. And of course, Marc hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Marc's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth. We're talking about my exhaustive hunt and journey to obtain a GLP-1 weight loss drug for my diabetes. So what I found again is that pharmacies losing money or barely making money is not unusual for GLP-1s and some other brand drugs from what I'm told, especially for smaller independent pharmacies without a lot of leverage in the system. Some larger chains have this problem too. And the more expensive the drugs are, as I said, the more probability of losses. The losses they suffer as a result of the opaque drug channel and the perverse rebate system we have with brand drugs. For GLP-1 specifically, a recent survey by the National Community Pharmacists Association, which is the lobby for independent pharmacies, found something very similar to what I just talked to you about. First, 90% of pharmacies would love to stock GLP-1s if they could. 96% said they experienced shortages or back orders. Just 37% said they were keeping stock on hand of the GLPs. 63% said they are ordering the products based on paid claims because of the drug's high prices and because the reimbursement from PBMs is often below the pharmacy's cost. So this survey of independent pharmacies pretty much jives with what I found in my exhaustive hunt to get my GLP-1 as well. So my journey on a GLP-1 was initially rocky. The drug shortage has admittedly settled down a bit for my specific GLP-1, and my new favorite pharmacy to which I am devoted for life, Walmart Pharmacy, continues to watch my back each month so I have no interruption in my therapy. My nice public sector retirement plan, too, covers the entire cost of my drug, and that's not something that usually many people can say. But access to GLP-1s and costs are very different for most Americans. My journey was easy compared with what many Americans go through finding and paying for their expensive drugs each month. I am among the lucky few, and that really means that we need to reform our drug price system. We need drug price controls. We need to get rid of the PBM practices that have rebate agreements between brand drug makers and the PBMs. And we also need an incredible overhaul of the opaque drug system to bring greater transparency and understanding of price in the drug system. With that, we'll conclude this edition of the Healthcare Labyrinth Podcast, and we'll see you next time. Take care.
Thanks for joining Mark and the Healthcare Labyrinth Podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth Podcast.